Accompanying me today are two of Chesapeake Healthcare's pediatric dentistry residents. With their co-residents, they are the only dentists on staff at our regional medical center to treat emergency patients, but they only do so for children. They see the sad situation of adults over and over again. They recognize the adults who come in as the parents of the very children that they treat, but they're unable to get treatment on their own other than for prescriptions. They suffer with their teeth, and then inflammation and infection take over. It worsens their cardiac care, their diabetes, puts them at greater risk for stroke and for dementia. I urge you to support HR1158 and take this to the governor so that the adults can reap the same benefits that their children have. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Eric Baker. I'm a pediatric dental resident at Chesapeake Healthcare. In my short time in my profession so far, I've already been I'm a witness of the need for dental care for adults. I was actually at the Mission of Mercy in Salisbury this past weekend, and it was pretty overwhelming just to see the need that's there. And I was especially moved by this one adult that was younger than myself, and we had to remove many of his back teeth, and I just see it every day, and it's just astounding. And the Mission of Mercy definitely helped me. It showed evidence that there are definitely a lot of dentists out there that would be willing to take part in accepting Medicaid coverage for adults. Thank you for your time.
Hello, my name's Preston Stewart, and I'm also a dental resident with Chesapeake Healthcare. Thank you for having us, Madam Chair and delegates. I too would just like to echo everything that's been said beforehand. In addition, I'd like to place extra emphasis on the point that was made about the psychological benefit that this really can have for adult patients. At Mission of Mercy also this last weekend, I had a patient who probably in his late 30s, his two front teeth just completely decayed, only half there. And we were only able to do 2 teeth for him, so we did those 2 front teeth. Repaired them. They look almost like natural 2 front teeth there. And as he was leaving, he turned to me and he said, "Thank you. This really was a life changer." And I do believe that. I do believe that when we are able to provide the care needed for our adult population to even aesthetically look kind of natural, it opens them up to be able to function more fully in society, in retaining a job, in being a good example to their children and to those around them. And it's for these reasons that I do strongly support this bill as well. Thank you, guys.
Are there questions of this panel? Delegate Peña-Melnick.
Thank you, Madam Chairwoman. The gentleman from the Bronx, if you're not from the South Bronx, you cannot sit with those 2 secretaries.
174th and Boston Road. So if you know the South Bronx.
Thank you very much for coming and testifying today. We appreciate it, especially in light of the weather today.